I think actually, and I'm basing this on experience that we've had from the genetic testing that we've started doing, both for our patients using their own eggs and in our donor program. People actually are not afraid of the genetic information. I was really convinced before we started doing this that people would have a don't ask, don't tell kind of attitude toward the genetic piece. But it's quite the opposite. When people find out they're carriers of something, they don't get upset. They're interested. And the reality is that in the next 5, maybe 10 years, it's going to be very inexpensive to test the entire human genome. And everyone's going to be able to walk around with their entire genome sequence on a flash drive and plug it into their doctor's computer. And their doctor's computer is going to say, oh, okay, so here are the drugs that are going to work best in you for certain conditions, and here are the diseases you're at risk for, so here are the lifestyle modifications you can make to help head off these diseases or mitigate those risks. And I think people are going to look at it in a beneficial way. So the fact that there are going to be a lot of donor-derived children in the world, I don't think really changes any of that. I think the only thing that changes is that it's going to be much more open. There are some DNA technologies that are emerging. They're going to make it possible to know who your baby mama and your baby daddy is if you didn't already. And that kind of information is going to be really, really hard to keep under wraps. Now, some of it obviously will be HIPAA protected, but some of it won't. And I think more and more people are going to say, oh, these are the 5 to 7 disease-causing genes I carry. What are the 5 to 7 disease-causing genes you carry? And it's going to be just kind of a natural part of a conversation. Our level of understanding of this is going to grow so exponentially that instead of being afraid of it, it's going to become part of our natural conversations.